Hi everybody, welcome to Grayscales. This is Dr. Cecilia from Anby Dental Scans. As a number of mucormycosis cases are increasing, I would like to highlight a very few points on the use of CBCT in the early diagnosis of mucormycosis. CBCT plays a very major role in the diagnosis and determining the prognosis of and the treatment plan for rhino maxillary form of mucormycosis. Of course, there are many forms of mucormycosis like rhino cerebral orbital, rhino maxillary, cutaneous, and other disseminated forms. But still, when it comes to rhino maxillary form, CBCT is the imaging of choice, where we'll be able to see the destruction of the maxilla and the involvement of the alveolus very clearly when compared to CT. So I would like to, we have received many cases of mucormycosis, and I'd like to highlight a few radiographic features of mucormycosis in CBCT. I'll show you a few cases. This is a 46-year-old male patient who was referred to a CBCT center. On curve slicing, the OPG view, we can see that there's extraction of 2/6 which was done recently. The patient complained of pus discharge from the extraction site, and so the dentist referred the patient to the CBCT. On seeing the cross sections, you can clearly see that there is a oroantral communication. There's oroantral communication, and this also associated sinus opacity with some air pockets which are trapped. Going to orthogonal slicing, on seeing the axial sections, see, you can see the difference between the right side and the left side maxillary sinus. As I go down to the maxillary region, this is a maxillary arch. I think you'll be able to make out the change in the trabecular pattern here and the change in the trabecula. It is more radiolucent. Of course, the cortical plates, the buccal and the parietal cortical plates are intact. Now you can see that the cortical plates have been obliterated. There is perforation, and yes, you can see the sinus opacity. Of course, here also there is some mucosal thickening on the walls of the maxillary sinus, but compared to the left side, this is much less. And also you can note that the nasal turbinates on the left side have been hypertrophied. You can see it clearly in this picture. The nasal turbinates here have been hypertrophied. This is a coronal section. Now you can see this oroantral communication and the involvement of the maxillary sinus, and also you can notice that there is some thinning and effacement in the wall of the lateral wall of the nose also. And also the nasal septum has been thinned out. There's some erosion in the nasal septum also. So this is also a case of mucormycosis. This is another case of a 55-year-old female patient who was completely edentulous and was referred to the CBCT center for pus discharge from the right side posterior region, almost in 161718 region, and there was not much of bone denudation there, but on taking a CBCT we could see an extensive lesion which is involving the entire maxillary sinus. I'll show you the axial section. It is an extensive lesion which is involving there is some amount of bone destruction in the right side alveolus also, and then there is opacity of the right maxillary sinus. When you compare the left and the right side, you can see the hazy opaque lesion which is involving the right side maxilla. The right side nasal turbinates are hypertrophied, and there is also pacification of the right maxillary sinus with some air entrapment. You could see that there is erosion of the nasal septum, and also there is thinning and bony effacement of the walls of the right maxillary sinus. Compared to the left side, there is reduction in the size of the maxillary sinus on the right side. As I move more towards the cephalic region, there is breach in the medial wall of the sinus, in which the lesion is from the sinus, the lesion is extending into the nasal right nasal turbinate region, and also involving the you could clearly see in this picture that the right ethmoidal sinus is involved, and also there is some erosion and thinning in the wall, nasal wall. The sphenoidal sinuses are spared, but there is involvement of the ethmoidal sinus. So this is another extensive lesion of mucormycosis. So this is what is CBCT, where such extensive lesions can be analyzed, and the prognosis can be made.